So welcome once again to everybody to this EPI-WIN webinar. The subject of this webinar is to give you an update on the recently announced nomenclature system for the SARS-CoV-2 variants, for use specifically really in the context of public or non-scientific discussion and communication. So it's really a pleasure to have you here today. I have a wonderful group of speakers from WHO with us. We have Maria Van Kerkhove, who many of you know is the technical lead for the COVID-19 response. We also have with us Frank Konings, who is the regional advisor on public health laboratories from the Eastern Mediterranean office. And we also have with us today Brett Archer, who's an epidemiologist and team lead within the epidemiology pillar of the COVID-19 response. So we will hear from each of these speakers today, and there will be time for Q&A afterwards. If you do have a question for a specific speaker, please do put it in the Q&A function of Zoom. And as per usual, we will be recording this webinar. It is live streamed to YouTube, so you will find the recording post-event there. And we will be sharing copies of the slide presentations with all those who have registered. So thank you for joining us today. And I'm going to hand over to Maria now, who's going to give a brief introduction. Over to you, Maria.
Thank you very much, Sarah. And hello to everyone who's joined us in this seminar today. Thanks for giving us the opportunity to give a brief update on some of the latest work that WHO and partners have been doing on the SARS-CoV-2 virus variants that are circulating around the world. I know that you've done several seminars related to this, but we wanted to give an update on some of the labeling of these variants of concern and variants of interest that WHO classifies at a global level. A few months ago, I tasked our teams and the Virus Evolution Working Group in particular to come up with a naming system to help us speak and selfishly to help me speak publicly about these variants of interest, variants of concern, because a lot of these numbers and names and scientific names are quite confusing. It's very hard to keep track of. Naively, I thought this would take a couple of weeks, but it has taken us some time. And what we thought is we would give an update on how we developed this nomenclature and the process by which we've gone through this. So Dr. Frank Konings is going to give an overview of how we came up with this system and give you some detail around that. And then Dr. Brett Archer is going to give an update on the latest of the tracking and the monitoring of these variants of interest and variants of concern. This is a work in progress. And so we're really grateful for all of our partners around the world who are helping to do surveillance with epidemiology and looking at viruses, molecular testing, sequencing. And you'll probably notice, and people who are joining in, I don't know the background of all the people who are joining in on this EPI-WIN seminar, but it's in the media every day. There's a new virus variant that's reported every single day, but it's important that we track them and that we study them, because not all mutations are important, but we need to know which ones are important, and really importantly, why. Because we have tools at hand. We have public health tools, we have diagnostics, we have therapeutics, and we have vaccines that are being used in this fight against COVID-19 to control the spread and to end this pandemic. And we, as scientists, as the World Health Organization, need to work with partners around the world to study each of these mutations and know which ones are important and if they have an impact on our countermeasures. So this is what we're doing. So today we're going to give you a brief update on how we came up with this labeling system. And I will pass it over to Frank. Frank, over to you. Thanks, Sarah, for having us.
Thank you, Sarah. Thank you, Maria. And also thank you, everyone, for joining the seminar today. Let me just pull up my slides. 1 second.
You are already sharing. Yeah, there we go.
All right. So today I will be giving an update on the SARS-CoV-2 variant nomenclature, as Maria has already introduced. So you may have seen in the media, we had an announcement earlier in this week on Monday, a media advisory on these new simple, easy to label, easy to use, and easy to say labels for SARS-CoV-2 variants of interest and variants of concern. And it has gained a lot of media attention. So I just got a few headlines that I saw passing by this week. I picked the majority are positive. There was also a few that are a bit more critical, but in general speaking, people feel that these names make things a little bit easier. It helps us to avoid stigma. And also the right bottom, you can see farewell B117, hello alpha. Not entirely true. We're still going to stick and use the scientific names as well, but we hope that we can use the new names, the new labels for public communication. But I'll walk you through this process together now that we're looking at this presentation. So let's take one step back and look at these viruses itself. So all viruses evolve over time, especially RNA viruses, and SARS-CoV-2 is one of them. So when that happens, these changes, or we also call them mutations, have mostly very little to no impact on the virus properties. However, there are some instances that these changes do have an impact, and it results in variants of this virus that may affect the transmissibility of the virus, the disease severity. Also, it may have a negative impact on vaccines, therapeutics, or diagnostic tools. So on the right-hand side, you can see this sphere of ball within on the inside a genetic material that encodes how the virus should be constructed and built and behave. On the outside of that ball, you have what we call spikes protruding outwards. And these spikes are the ones that are being used by the virus to attach to the human cell and also to enter and make more copies of itself. So especially changes or mutations in the spike is what we're looking at to see if it affects those different properties that I just mentioned. There are other parts of the virus that may also change, but this is the particular area that we mostly look at. So you may have heard over the last couple of weeks or months, or in the context of this nomenclature, about the WHO Virus Evolution Working Group, or the VEWG. Well, what's that? The WHO Virus Evolution Working Group actually is part of the WHO larger global COVID-19 reference laboratory network that has monitored these SARS-CoV-2 mutations right from the start of the outbreak all the way in January 2020. As soon as we started to see that these mutations and these variants were becoming more and more important and it required more attention from WHO and the research globally, we established in June 2020 the Virus Evolution Working Group. It's a group of about 20 international experts, mainly virologists, with various different kinds of subspecialties. Some are looking at a particular mutation, others are looking on how the virus behaves in cell culture, and so on. We also have evolutionary biologists, and we'll look at the different sequences and try to analyze these sequences and come to conclusions. We'll see a little bit more about that later in this presentation. And most recently, we've also been adding some clinical experts and epidemiologists, and also we have members of the observers from the animal health sector. So the areas of work of the Virus Evolution Working Group are as follows. We look into identifying and prioritizing these mutations or changes. And we also involved in designation of variants as either variants of interest or variants of concern. And then we assess the impact that these mutations may have. We are looking into the research that is being done to better understand what these mutations really mean. And then also looking into the options and possibilities for mitigation strategies for these kind of mutations. So it's a very active working group, Virus Evolution Working Group. It will become even more active as we are moving forward. And for the purposes of this presentation, it plays a key role in the designation of variants of interest and variants of concern. So what are these variants of interest and variants of concern. On the left-hand side, you can see a blue box for the variants of interest. So these are viruses that have acquired mutations, and what we've observed is that they have community transmission, smaller clusters, and so on. So there is an indication that we need to take a closer look at these viruses and keep a close eye on them to see if they evolve into more serious variants. On the right-hand side, you have the variants of concern. And there we know that this virus has increased transmissibility. We know that there may be a different clinical disease presentation, and we also may know about the impact on public health and social measures, diagnostics, vaccines, and therapeutics. Aside from these variants of interest and variants of concern, there are many, many other variants, and these are actually the large majority. And these variants actually have no evolutionary benefit to the virus, and it may actually be a dead end. So the variants of interest and variants of concern, as of now, are only a handful or two handfuls. So far, we have only seen 10, and we'll see that later. But there are many, many others that are not variants of interest or variants of concern, yet they are still variants. So let's take a closer look at naming these different virus variants. And we weren't the first to look at this because there were already several nomenclature systems in place for naming these variants, for classifying and naming these variants, but they were mostly directed at scientists. So we have what people may know, the GIS8, the NextStrain, and the Pango. And these have all been established systems even before we came up with the definitions for variants of interest and variants of concern. These different systems look specifically at the virus sequence. So at all the different letters that make up the genome of the virus. And they do not fully take into account the biological properties of the virus that I've just showed you, the transmissibility and how the interactions with the vaccines, therapeutics, and diagnostics. But really, they're focusing mostly on the sequence itself. So these three nomenclature systems are very useful and very important, and they will continue to exist because they allow the scientists to have a common language in which they can discuss and investigate the evolution of SARS-CoV-2. I'll give you an example in the next slide. But these different nomenclature systems can also be quite complicated and difficult to pronounce. The names of these that are being used by these systems can be, as you know, B117 and others, a combination of letters and numbers or an alphanumeric code, and not easy to remember and not easy to pronounce. And to assist with public discussion of variants, the WHO Virus Evolution Working Group, and also additional scientists who are familiar with coronaviruses, who are familiar with nomenclature for viruses and bacteria, decided to develop an easy to pronounce and a non-stigmatizing labels for these variants of interest and variants of concern. Non-stigmatizing because very often, because these scientific names are so complicated, people refer to these variants based on the country where they were first detected. So we have the labels of GIS8 and NextStrain and Pango, again in bold, remain to be used, are used by scientists. So this is an example, and I purposefully took a figure from a paper to show you how complex, how complicated some of this work that's being done with the sequences is. This is a paper by Professor Turlio de Oliveira, who's a member of our Virus Evolution Working Group, and he does a lot of research on variants in South Africa. He's at the University of KwaZulu-Natal. And here he describes all the different strains that have been sequenced in South Africa, and he studies how these viruses move in South Africa. And he also strives to group them together to see where they fit and how they belong. And you will see on this slide many different dots many different letters and numbers, but they are very, very helpful in understanding the evolution and the spread of this particular variant in South Africa. But it doesn't really make public communication a lot easier. So in order to move forward with these different names for the variants, the names for public communication, we've considered several different options, and it took us actually quite some time because we had these discussions among many different scientists, many different opinions, and we looked into very many different options. As I said, we wanted to not have the scientific names because they could cause confusion among the public. And also we would like to move away from anything that has to do with country names for the stigmatization. So one of the things that we thought of is we call them variant, VAR, variant 1, variant 2, variant 3. But we thought that looks too similar to having the scientific names, and it doesn't really roll off the tongue that easily. We considered also other terms, like instead of VAR, just V, V1, V2, or VOC, which could be offensive in some languages. Next, and we actually spend a lot of time in this area, we're looking into portmanteau names, a difficult French word, but what it really means is you use the beginning of one name and you add the end of another name. So for example, if you look at the first bullet here, if you take the first letters of Minerva and you add the last letters of Atalanta, you end up with Meta. That's 2 syllables. It's actually a nice word, but if you Google it, you will find that it's already being used by a company, a location, and I believe this one also has a geographic location somewhere. I forgot where exactly. So we couldn't really use that one. So then we thought, okay, let's do the same thing and add a connecting piece in the middle, like AN. So you have Minerva, AN, Paphos, and you end up Mianos. And then you have 3 syllables. But still, for these three syllables, we saw it's still very often connected to a name of a person, a place, or a company. And as we went on, we had 4 syllables, but at that stage, it became just too unwieldy, very too long, not easy to pronounce and remember. So we started to brainstorm about what could be next. So then we came up with the letters of the Greek alphabet. And this was something that people were very interested in. They are easy to pronounce and they minimize the negative effect on countries and their citizens. As we all know, alpha, beta, gamma, and so on the right-hand side, you can see them all. And they're really intended to be seen as letters as part of the alphabet. Some also have other implications, but we really present them as the string of letters that all combine the alphabet in Greek. So we also know that we are aware that there are only 24 letters in the Greek alphabet, and once they will be completely absorbed or used, we will start looking into other lists of names. In fact, we're already looking into other lists of names. But luckily, if you think of it, we're now 1.5 years into the pandemic, and we're 10 letters down the road, so to say, as you will see in the next few slides. So hopefully, we will not be needing many more letters, but it's good to see that we have these letters available, and we're already looking into other lists of names as well. So here you can see, I purposely showing it like this because this is really quite intimidating. Here you see for different variants, you will see the different names in the 3 different scientific names. So you have the B117, you have the B1351, the P1, the B1617.2. And as more are added to the list, it will become harder to remember and harder to pronounce. So I think if you ask me, alpha, beta, gamma, and delta will sound a lot easier to remember, to discuss publicly, and the scientists can still use the Pango, Giz8, and next string denominations, names. Aside from the variants of concern, we also have the variants of interest. global variants of interest. At the moment, we have 6. They all have these names as well in the 3 nomenclature systems. But for WHO, the label will be epsilon, zeta, eta, theta, iota, and kappa. So much easier to remember, pronounce, and there's nothing stigmatizing, no country connection. So how does it all really work? That's the question that I get quite often. It's all related to the WHO working definitions for variants of interest and variants of concern. And as soon as these variants that we're looking at have been designated by the Virus Evolution Working Group as either a variant of interest or a variant of concern, they get that label right away. The Greek letter label is attached immediately and then linked to the existing scientific names. The reason why we are already attaching a label to the variant of interest is that we want to make sure that if that variant of interest becomes a variant of concern, it already carries that label. So we can immediately start discussing using the Greek letter label that's attached to it. Then finally, the new Greek letter and the label and the connections are published on the WHO website that tracks the SARS-CoV-2 variants. And the link you can see on this slide, and I highly recommend that you take a look at it. It's a very informative website, and you can find a lot more information about everything that's related to SARS-CoV-2 variants. So here are just a few additional resources that you can take a look at, and also some links to the different scientific nomenclatures. It's worthwhile if you're interested in this to click on them and just browse the website. It's very interesting and very informative. Finally, this is my last slide. I do want to mention that even though we're dealing with all these different variants, all these different COVID-19 protective measures still work. So keep your distance, wash your hands, cough and sneeze into your elbow, work and spend time in ventilated places, and wear a mask. So thank you very much, and this is the end of my presentation.
Thank you very much, Frank, for your presentation. We're now going to move to Brett, who's going to give us an overview of the epidemiological situation with regards to the variants. So Brett, I will share my screen and just indicate when you'd like me to move to the next slide.
Fantastic. Thank you very much, Sarah. And good morning, good afternoon, and good evening, everyone. Thank you very much for joining us today. So I'm going to take you through a little bit of the sort of background in terms of the global epidemiological situation as it is now, and take you through a little bit of an update around the variants of concern that we've been tracking quite closely since the beginning of this year. So you can jump to the next slide, please, Sarah. So this is the global epi curve that I'm sure you've seen many, many times. It's really promising news for us to see this decline continue for the past recent weeks. Declining cases, declining in deaths globally has been observed, but we really want to stress that the risks associated with this pandemic remain very, very high. We're still at very high rates of transmission. There's still around the world areas that have growing transmission activity. Therefore, we really want to stress that do not think because it is declining in your area, perhaps that the risks have gone. And I think this is a big, this is a time where we've seen in the past where cases come down, but later on we see them come up rapidly again as people relax a little too much. So in the last week, we've seen over 3.5 million new confirmed cases reported. Now, we know this is an underestimate, so likely a lot more cases happening within the communities. 78,000 people have lost their lives just in the last week, and over 3.5 million deaths have occurred to date just from COVID confirmed cases. And again, that's probably an underestimate of both the indirect and direct effects of this pandemic. So these declining case trends and death trends are largely a result of decreasing case incidence within Southeast Asia, primarily decreasing in India, as well as across the European region. Other regions, however, are either slowly declining or starting to increase again. For example, within the African region, we've seen a 22% increase in cases in the last week, as they're sort of starting to now prepare, I guess, for a third wave of the pandemic potentially coming their way. Cumulatively to date, over 170 million cases and 3.5 million deaths. So, I mean, these are massive figures and quite sobering, but we just wanted to really stress that this is far, far from over. Next slide, please. So in terms of cases in the last 7 days, as I said, although we have this declining trend, we have a number of countries still reporting high caseloads, but also some areas that are reporting increasing trends. And in fact, there's countries in every single region that are still reporting increasing cases as the pandemic progresses. Next slide, please. So Frank briefly introduced you to some of this global evolution. I think what we want to show with this slide is that the SARS-CoV-2 virus is very diverse. The variants of concern make up a small proportion of cases that we are observing and a small proportion of the viruses that we are observing. And over time, this changes, but also between geographical regions, this changes. So it's a continuous evolution that we're tracking. What is a variant of concern today may not be a variant of concern tomorrow as the virus continues to evolve, and new variants of interest and concern may arise over time. Next slide, please. So Frank took you a bit through this signal process of how we're looking at the virus, how we're detecting the emergence of new variants, and how we're assessing them. So from the team here in Geneva and through a global effort with all our regional offices and country offices, through expert forums, through the research and reference laboratories throughout the world, we're detecting continuously new signals of potential variants of interest and potential variants of concern. This is really a continuous day-to-day process. And as Maria said, every single day we have a new signal almost that we're trying to assess whether or not it meets or could meet the definition of a variant of interest or concern. Amongst that, we've tested or assessed thus far 51 likely signals that could have met those criteria. And through applying the criteria outlined within our working definitions, we've reviewed those against those criteria, and also what is the likely risk to global health. So we've come up with a list of 4 variants of concern and 6 variants of interest. But just to stress that national authorities and local authorities may designate other variants of interest and local concern based on what is happening within a country. And we've seen many countries have a different list. This is okay. What we're focusing on here with this list is those that are likely to cause global issues. And as I said, so we've assessed 51 signals thus far. 4 of those have resulted in variants of concern, 6 variants of interest. We have 9 other variants that we're tracking very closely because they are likely either to become variants of interest or concern. It's just a matter of time that we need to build the evidence around them to see if there's any phenotypic impact. 27 other variants have been discarded or classified as non-variants of interest and concern, but we're still monitoring these quite closely through ongoing surveillance, and we might revisit them as new information arises. Next slide, please. So this looks at the basically the phenotypic impacts of the 4 variants of concern. So all of them have been detected in a large number of countries to date, and as surveillance increases throughout the world, as the time it takes to upload a sequence, to have a sample, to sequence a sample, and upload those data to the core databases, we're able to see these variants emerging in a number of countries. Now, the countries reported there, some of them are only seeing the variants come in through travelers, have or detected at points of entry, so may have not had local transmission. Others have seen large outbreaks associated with these variants of interest and concern. All the variants to date have had a substantially increased transmissibility. I'll take you through a little bit more on that in 1 second. But they also have some other impacts. Some have potentially increased severity in terms of disease. Some have an increased risk of hospitalization or death. But this is something that is always continuously changing with new evidence over time. Some have increased risk of reinfection following a natural infection. Most people will develop some immunity, but what we've seen potentially some reduction in so-called neutralizing antibodies. But for those that have built a substantial evidence over time, what we see is other immune systems kicking in and potentially providing protection to individuals. None of the variants thus far seem to have had a major impact on the variants of concern thus far have had a major impact on diagnostic tools. PCRs remain mostly effective, RDTs remain mostly effective, but we're also looking at potential impacts for other sort of variants of interest. For example, there was one variant that was observed in France recently that had a decreased detection by nasopharyngeal swabs. That became a variant of interest, but that outbreak has now been controlled. Therefore, it is no longer a variant of interest on our current list. The other thing that's been tracked very closely is the potential impact on vaccines. Now, consistently to date, what we've observed is the vaccines remain largely effective against the variants of interest and variants of concern. There has been some studies that have observed some potential impact, particularly for the B1351 variant beta. But this is, again, something that is evolving with time and as evidence grows. Next slide, please. So this is the global distribution as it stands today. Again, just to repeat, these are countries that have detected variants of any sort. So this could be detections at points of entry by testing travelers or local transmission within their countries. Next slide, please. What we've seen time and time again is that variants of interest and variants of concern, because they've had an increased transmission rate, they quickly become dominant in many countries. But this picture does vary depending on where you're located. For example, within the United Kingdom, we've seen that the variant of B117 quickly took over other variants. But now, amidst a decline in case incidence, they've seen more and more cases of the latest variant of concern, variant Delta. Next slide, please. This is some in-house analysis that we've been doing within WHO to look at what the relative sort of change in transmission rates are. So we're looking at change in the R number over time for each of the variants, utilizing GISAID data, but looking at sort of how quickly these variants are changing over time. Consistently, as I said, we've seen across the board increased transmissibility for these variants of interest and variants of concern. Just to point out the latest added variant of concern, that's Delta, the B1617.2, that was first identified within India, shows a much higher rate of transmission, and that's likely had a role to play in some of the recent resurgence that we've seen throughout the world. Next slide, please. I put this up here just as really a warning for the rest of the world that we need to keep our guard up with regards to not only the variants of interest and concern, but maintaining all public health and social measures as best as we can. So what we saw in India was a major surge in cases and deaths. But this was in the context of, number one, the more transmissible variants being observed, but also within the context of a relaxation of public health and social measures, including many mass gatherings, but what was also a very susceptible population, relatively low vaccine coverage rates, and the seroprevalence surveys that was observed had mixed findings. So some areas had quite high rates of seroprevalence, so potential natural immunity, but other areas were quite low. What we have had is quite a naive population that, given the opportunity for the virus to spread, it took advantage of that, and the occurrence of a variant of concern and with increased transmissibility really took advantage of chances for it to spread. But fortunately, what we've seen in most recent weeks within India is they're now getting control over it. They're getting control over it with proven response strategies through using the standard public health and social measures, IPC measures, vaccination to bring transmission levels down and under control. And this has been repeatedly demonstrated time and time again within countries that have experienced large surges with variants of concern. For example, South Africa, United Kingdom, they've all seen this impact, but managed to bring it under control through the current existing strategies. So we would like to just reinforce that we need to continue to do these activities. Next slide, please. And last slide from my side, just to really highlight that there is a lot more information out there within the WHO COVID-19 weekly epidemiological update. Every week, we provide an update on variants of concern, including the global distribution, but also every second week, we try and do a deeper dive within some of the phenotypic impacts and some of the emerging evidence that is coming out, including looking at preprint studies before they are peer reviewed, just to see if there is major impacts in terms of these variants. And that's it from my side. And back to you, Sarah. Thank you.
Thank you very much, Brett, for that overview. Unfortunately, I think Frank has dropped off, but in any case, we'll try and move now into a period of Q&A. And there's lots of questions that have come in. I'm actually going to stay with you, Brett, if that's okay. We had a question that came in over email prior to the webinar, and that was related to the potential impact of the variants on the vaccines. You did show a slide with the table where you did address this to some extent, but the question is really about, do we have any further information on the specific or the different vaccine families and which is likely to be more effective against variants, or at least more easily modified to be effective against variants?
Perhaps I'll start, and Maria, please jump in and complement. So within the weekly report I just mentioned, we do sort of go into a lot of detail with each of the vaccines. It is very important that each of the vaccines gets examined closely. So there is neutralization studies that are done in vitro within a laboratory that are one bit of evidence, but more critically, we need to see what the real world impact of these variants of concern are. And sort of as I mentioned, more consistently throughout, we've seen that the vaccine does have an impact on disease. Still with the variants of concern, so it protects the majority of people that would be vaccinated, and that's consistent throughout. But some vaccines appear slightly less effective to some of the variants of concern. Now, again, this is sort of an emerging area. Lots of evidence needs to be gathered here, and where we've seen sort of more evidence, for example, with the B1351 variant, there is some evidence of slightly reduced protection against the disease. But for other variants of concern and variants of interest, consistently, we've seen that the vaccine is likely to remain protective against the virus. Maria, did you want to complement?
No, I think that's great. Thank you, Brett. But I do want to emphasize what you just said and to look at the latest SITREP that we produce each week, because that's the latest information. All of this is coming in really fast and furious, and there's a lot of people around the world studying. So we're doing our best and working with partners to keep up to date on everything that's coming out, including preprints, as Brett mentioned. So do look at our SITREP that's published every Tuesday on the website. Maybe we could provide that link in the chat if they don't have it.
Sure, thanks, Maria and Brett, and I can also send it in the follow-up email to all who have registered. Speaking about fast and furious, do we know anything about the pace of mutation of SARS-CoV-2? And is there a maximum limit to the number of mutants that may arise?
So that's a great question, and I'm really sad that Frank is not on, because I am not a virologist. There is an expected rate of mutation that we expect for viruses. And as an epidemiologist, I don't want to overstate what I know about this, but in terms of the pace at which SARS-CoV-2 mutates and changes, it's at a slower rate compared to some other viruses that are out there that are circulating. And so there is an expected number of mutations that we expect every month, or every time it transmits between people. And it happens on the slower end. And so we're not seeing, I know you use the word mutant, but I have to say, as a non-virologist, when you say mutant, I think of, science fiction movies and superhero mutants out there. But what is critical, Sarah, is that every one of these changes is studied. And so what's happening is that variants are constellation of mutations. There's a number of mutations that are being picked up in the variants of interest and variants of concern. And there are a lot of studies that are underway looking at each one of these mutations, the 501Y, the Y144, the deletion 6970 deletion, all of those. And there are studies that are being done to understand what that means in terms of the virus's ability to adhere to the cell and infect the cell, the neutralization aspects of it. And so what we're doing is we're tracking these mutations and looking at which ones are important. And so a lot of the variants of interest and variants of concerns have similar mutations, have similar combinations of mutations. And it's this convergent evolution that we're actually seeing worldwide. I don't know if there's a maximum number of mutations. I mean, it's a 30,000 base pairs. So I guess you could have a mutation in every single one of those, but that's not really what's important. What's important is where those mutations are occurring, particularly on the spike protein. Brett, do you want to say something?
Sure. I think the only thing I can add is, as long as that we still have transmission of this virus occurring, the more and more cases we have, the faster it's going to replicate and the faster it's going to mutate. As Maria mentioned, is that this virus is continuously developing new mutations. I mean, each of these mutations is some of them are just errors within the copying of the virus, and most of them actually don't cause any impact on the virus. Some of them, however, have a sort of advantage that it gives the virus an advantage, either sort of helps it replicate better or helps it bind better to the cells, or provide some sort of advantage. And this is where the variants of concern are coming in. Just to highlight that we're not sort of concerned about individual mutations. What we're more concerned about are constellations of mutations, lots of mutations happening together that have a synergistic effect, and provide that sort of real impact in terms of either increasing transmission, increasing disease severity, or having some sort of impact on our countermeasures. So this is what we're trying to sort of monitor most closely, which has resulted in sort of the definition of variants, and even the definition itself is quite a difficult one to sort of narrow down. Thanks very much.
Thanks very much, Maria and Brett.
Frank is back. Yeah, welcome back, Frank. There was a perfect question for you. I wonder, sir, if you could add it again, if you could say it again, because it would be great for Frank to add.
Sure, Frank. We had a question coming in about do we know anything about the pace of mutations of the SARS-CoV-2, and is there a maximum limit of mutations that may arise? Did you hear us okay there, Frank? I think we have a limited connectivity with Frank. Maybe, Frank, if you wanted to try switching off your video, it might make your connection a little stronger. Frank, I'm sorry, we don't. Frank, I'm sorry, we don't hear you, unfortunately.
Yes, can you hear me? I'm going to stop my video.
Okay, let's try without your video, and then
Can you hear me now?
yeah, we do. It's better. No, we don't. All right, we'll move on to another couple of questions and hopefully get back to Frank shortly. And this was actually would have been another question for Frank, but I'm guessing that Maria, you know, is the list of the virus evolution working group something that's publicly available? Do we know which countries are represented on that?
We do, of course, know the people who are part of that virus evolution working group. I don't believe the list is online. However, we are making some modifications to the virus evolution working group because WHO has set up a system globally to monitor, track, and assess these mutations. The virus evolution working group is one part of that. What we're doing right now is we're expanding that, the composition of it, because right now it's mainly made up of virologists, people who work in the lab and actually work with viruses to do the animal-based studies or laboratory-based studies to examine transmissibility, neutralization, things like that. And what we're doing is we're adding some epidemiologists, so individuals who are part of our epidemiology technical advisory group that supports WHO on a variety of different aspects related to epi, and our clinical management group. So we're adding some composition to that, and we're expanding that membership. But what is really important for WHO in all of the networks that we have is that we have good geographic representation, and we make sure that we include expertise from around the world. We don't just go to certain regions. We don't just go to high income countries. And we also make sure that we have good gender representation as well. And so it's not online yet, but it may go online. We do have a paper that's coming out related to the nomenclature. It will be a commentary in Nature Microbiology. I'm hoping it will come out in the next day or two, and there will be a list of the people who contributed to the nomenclature work, including people from the virus evolution group working group, as well as others who have expertise in taxonomic issues related to viruses.
Thanks very much, Maria. And maybe another question for you, actually. How much buy-in to this new labeling system would you expect among world leaders? Do you think that they will start using these names relatively quickly at their high-level briefings?
We hope so. I mean, that's really the aim. I have to say I'm encouraged because this week we announced this on Monday. And even the first question we got at the press conference, the journalist used the names, which I was very proud of. And we are seeing some leaders actually use the name so far. So we hope so. I mean, what we really need is to remove country X variant, country Y variant. And, that really may sound trivial, but it does have an impact. And we need countries to continue to report. We need countries to continue to detect and report. And so we're hopeful that leaders will use this labeling system.
Thanks very much, Maria. And probably linked to that, there was a question actually about the risk communication needs around variants, and is WHO doing anything in this space? And I know at least that we have definitely one of our Science in 5 episodes on the variant. And again, we can put that into the link to that in the communication that we send out, and we have Q&As as well on the website. So those are some of the products. Yeah.
We do. We have some Science in 5s. We have some Q&As on this. But I think what is important from a public health point of view, in my own opinion, is that the SARS-CoV-2 virus itself, virus variants or not, is a dangerous virus. So from somebody at home, what variant is circulating in many respects doesn't matter. Because if the virus is circulating, the steps that you need to take to protect yourself, to protect your loved ones, to protect your community are the same. The challenge with the variants of concern is that they have increased transmissibility, which means the more people who are infected, the quicker it can burden your health system. It can burden the system that's there to detect and do the testing to care for people in hospital. And that can happen very quickly. And globally, a lot of systems are already overburdened. But from a general point of view, if I'm talking to my family, if I'm talking to my friends, any virus that is circulating, you need to take steps to protect yourself. So it doesn't matter if it's the Delta variant or if it's the Alpha variant or if it's a new variant that's detected tomorrow. We need countries to apply a comprehensive approach to prevent infections, to reduce the spread amongst those who are infected, to make sure that anyone who is infected receives appropriate clinical care, because right now we actually have tools to minimize, to drastically reduce severe disease and death. And we have vaccines that are available, unfortunately not available around the world, and their uneven and inequitable use is really limiting our ability to prevent infections, prevent severe disease and death. So we have to do it all. We have to continue to do it all. So from a general point of view, what you need to know is if the virus is circulating, know what your risk is every single day and take steps to reduce your risk of exposure, risk of infection, reduce the risk of spread.
Thanks very much, Maria. So we're nearing the hour, so we'll have time for a few more questions. Probably one for you, Brett. Do you recommend continuing surveillance testing of vaccinated individuals to look for breakthrough infection associated with variants in certain settings?
Yeah, so the short answer is yes. So what we care about when we're looking at the sort of variants of concern in terms of sort of global surveillance is, number one, providing a sort of a representative sample of what is circulating within your local community. And WHO has put out some guidance to this effect, but also we'll follow very soon with some new guidance that's looking at how countries should be establishing their surveillance and what can be done in high capacity settings versus what could be done in low capacity settings, especially within the sort of the areas with limited capacity to do sort of extensive sequencing. What we're recommending is to look for any sort of unusual epidemiological triggers that could say there's something different happening here. Therefore, we need to have a close look if potentially a new variant or a variant of concern is resulting in this impact. That is part and parcel of a wider sort of epidemiological investigation that looks at other factors as well that could be affecting how the virus is transmitting and who's getting infected. And so vaccination breakthrough could be one of those triggers to consider in terms of was it due to a variant of concern or a new variant occurring. But it's very important that it's done systematically, looks at all the factors and don't jump to conclusions. Just because you get one breakthrough case doesn't mean your vaccine is not working. It needs to be looked at over time over an entire population to really understand those impacts. Thanks.
Thank you, Brett. We're going to try Frank again. Frank, can you hear us?
I can hear you. Can you hear me?
Yes, we do now. Great. So we'll try and direct a question to you as well. I don't know if you wanted to comment on the first one about the pace of mutation and the maximum limit.
Yes. Yeah, so
I think the
pace of the mutation. Oh no, can you hear me or not?
We can now. There seems to be a bit of a delay, but carry on. I'll interrupt you if we lose you again.
All right. In terms of the rate of mutation of this particular SARS-CoV-2 coronavirus, actually, it's lower than many other RNA viruses that we know because it has a proofreading mechanism that corrects some of the errors that it makes when it replicates. So it's slightly lower than what we see with other viruses, like, for example, HIV, which makes a lot of changes and also mixes different kinds of strains up into a new virus, a recombinant virus. In terms of the maximum number of mutations, I think there are many different options possible. But as I mentioned earlier on, many of these options actually result in the virus unable to replicate further. So it's a dead end. So it has no impact or benefit to the virus to have that mutation. So it will lose it again, or it will not further replicate as such.
Thanks very much, Frank. And while we have a working system with you, maybe we'll direct the last question to you as well. We have a question from Roy that says, if a variant of concern and there are two or more distinct lineages, Will one of those lineages then be assigned the next available Greek letter, or will it be given a label that links to its origin, for example, Delta 1?
Yes, that's a very, very good question, and that's a discussion that we've had for quite a long discussion also in the virus evolution working group and the nomenclature working group as well. I mean, the whole purpose of this endeavor is to come up with labels that are clear and that aren't too scientific looking. So if you have then again a Delta 1 and a Delta 2, you end up with something that's very similar to what we had before. So we will be giving them a separate label to distinguish this particular new variant of concern or variant of interest. And again, we will follow the WHO working definitions of variants of interest and variant of concern. So if based on those working definitions, they are assigned as a new variant of interest or a new variant of concern, they will get another label.
Thank you very much, Frank, and I'm glad we could have you back with us for the last part. So we're out of time, unfortunately. I just wanted to say thank you very much to Brett, Maria, and to Frank for being on this webinar and for answering all the questions so eloquently. So it's been wonderful to have you, and thank you to everybody who has joined the webinar. I will just reiterate that we will share copies of the presentations and the recording and links that were mentioned during the webinar over email after this event. So any final comments, Maria, Brett, or Frank? No. Great.
Thanks for having us, Sarah. Bye.
Thank you very much.
Bye. Have a good